Hey, Margie here. I love when you can discover natural ways to improve your bones and overall health. And herbs falls into this category because it's something that's available, it's in nature, but oftentimes we just don't know how can we use this? What are the best ways? What will it help? Well, today we're going to answer all those questions and how we can use this to reduce inflammation and improve our bones. So I'm so excited for our guest expert today, and that's Dr. Darin Ingels. And Dr. Darin is a licensed naturopathic doctor. He's an author, international speaker, and leading authority on natural medicine, including herbs. Dr. Darin found that proper diet, lifestyle management, and natural therapies worked with his body to heal instead of against it. And then he applied what he learned about diet and lifestyle management to his own patients and found they recovered faster and with less side effects. So Dr. Darin has now treated thousands of patients with chronic illness using his novel approach, many who have gone on to live healthy, symptom-free lives. And herbs are a big part of Dr. Darin's approach and how we can use these in our lives. And I'm so excited because I've known Dr. Darin for a long time, and he is just a wealth of information. So stay tuned. Welcome, Darin, to the podcast.
Oh, thank you, Margie, for having me.
Well, this topic is really great. When I heard that you were doing, that you were going to have a whole program about herbs, I said, you have to come on the podcast because there's so much confusion and people don't know, are herbs good? Are herbs not good? Are they safe? Are they not safe? There's just a lot of questions when it comes to herbs. And I know you could help us sort of get through this. And so we understand how this could benefit us in so many ways and how we can do this safely. So welcome.
Well, thank you. Again, it's always a pleasure to talk with you and help your community. And, herbs are one of these things I think are greatly underappreciated in our cabinet, in our world. If you look around the world culturally, herbs have been used medicinally for hundreds, thousands of years. We see this in traditional Chinese medicine. We see it in Ayurvedic medicine, which go back 5,000 years each. And you think about all the herbs that are in your day-to-day cooking that can be beneficial. You may not think that adding that little extra garlic to your food can actually do something beneficial for you. But we know in the case of something like garlic, if you get even one or two little cloves, which isn't that much, can actually help lower your cholesterol. It can help improve your blood flow. It helps support your immune system. And so, you can look across your whole cabinet and think about something like garlic and rosemary and thyme. And if you start to learn a little bit about what these herbs are, what components they have in them, you can figure out how you can start incorporating them into your day-to-day life for all these various different, health benefits. And in some cases, again, you don't need massive doses of these herbs to get those benefits. I think when we think about drug therapy, sometimes you have to take a lot of a drug to get whatever, effect that you want from it. But in the case of a lot of herbs, sometimes a little goes a long way. So I really wanted to help educate, your community on how to look in your kitchen cabinet. And if it's not in your cabinet, how you can start incorporating different herbs into your daily life to, help the different things that people are struggling with. But I think as we're talking about, osteopenia, osteoporosis, we know one of the many, many factors that can drive bone loss is inflammation. And we've all had the experience of having inflammation, right? So, how can then we start using herbs to monitor or manage that inflammation, and with the hope that if we can keep that under control, that's going to help with bone growth.
Absolutely, because that's one of the root causes that's never, it's so unfortunate to me that people will go to the doctor, they'll get the DEXA and it will show that they have osteoporosis and okay, maybe vitamin D, calcium,
Right.
medication. But what about, is there inflammation? What about the root cause? It's oftentimes not even appreciated that there might be underlying inflammation. And we really need to deal with that if we're going to treat this effectively. And we do. That's the good part. Not only do your bones get better, but everything. So inflammation is just such an important piece of the equation. And I think it's so exciting because with inflammation, it actually causes an increase in the breakdown, in the osteoclast activity, the cells that break down bone, and that
Right.
can be measured. So we can really think when people start more of an anti-inflammatory or to address the inflammation, they'll actually see changes. I've seen this all the time in their bone turnover markers. And that's the beginning of things starting to progress and such an important piece. So let's just go into what herbs, what have you seen? Let's start with inflammation. Let's start with what have you seen? Like, what are the herbs that people can put into their life? And that's what's also fun. These can be, as you said, in your kitchen cabinet. And a lot of times people will think, oh, for the medicinal, just like you said, for to get a medicine, it's for it to actually work, I have to take it in capsules or I have to take a medicinal, I have to take it in such high dose. So why don't you just start off with your favorite, what you've seen has been most effective in helping inflammation?
Sure. And, before I jump on that, I should also add, the other benefit of a lot of these herbs, a lot of herbs are very mineral dense. They bring up the nutrients from the ground. And if you look at, the basis of bone breakdown, osteoporosis, it's the matrix of the bone really that's broken down. Well, what makes up that matrix is a lot of mineral content, things like silica and boron and phosphorus. And a lot of these herbs are rich in these minerals. So in addition to controlling inflammation, we're also providing that nutrient density to provide the matrix of the bone to rebuild it. So I just want to add that before we start talking about the anti-inflammatory effects.
Just want to say that's really important because we need those minerals. They're absolutely essential to strong, healthy bones. So I'm glad that you included that.
Yeah, it's not just about giving you more calcium. The calcium has no place to deposit if the matrix of the bone isn't built correctly. You can take all the calcium you want in the world, but if the matrix is weak, there's no place for that calcium to deposit to make the bone strong. So definitely, getting good mineral content through these plants can be very beneficial. So, the anti-inflammatory herbs, we've got a lot of them. I think the one that most people are probably familiar with and probably heard about is turmeric. And, turmeric is been used probably mostly in, the Indian culture, but it's a very powerful compound that contains something called curcumin. And curcumin is probably the most well-researched anti-inflammatory herb in the world. They've done studies comparing it to traditional anti-inflammatory medications like Celebrex and Vioxx. They find it works at least as well, if not better. Because, when you take a lot of these NSAIDs, things like, ibuprofen, Aleve, Vioxx, Celebrex, all these kind of things, if you take enough of it over time, it can really do a lot of damage to your stomach, your gastrointestinal tract, causes heartburns, ulcers, things of that nature, where we really don't see that kind of effect with curcumin. Curcumin is actually part of a broader category of what are called curcuminoids, and there's a lot of them. And again, this is really one of nature's best anti-inflammatory medicines out there. So it's something where you can start adding turmeric to your food, or you can buy supplements that are made of curcumin. In all fairness, the supplements of curcumin are going to be more beneficial in controlling inflammation than just adding turmeric to your food. Curcumin does have a little bit of an issue around absorption. It is not something that's easily absorbed by itself. So, the companies that make these curcumin extracts do different things to increase the bioavailability of that compound. So they'll put it in a liposome. Sometimes they add something called piperin in it to increase the absorption. But there's some really great curcumin products on the market. And the beauty is again, you can use it for any kind of inflammatory condition. If you've got gut inflammation, if you've got arthritis and, pain in your joints, if you feel like you're getting brain inflammation, if you're getting, muscle pain, there's very broad spectrum activity of this anti-inflammatory. The trick to curcumin is you definitely want to make sure you take it with food. It's one of these compounds that needs food to increase its absorption, and therefore it's going to improve the activity of that. But again, you can find curcumin everywhere. Again, there's some really great curcumin products out there. There's a couple of specific curcumin compounds that have been well studied. One's called BCM95, one's called Longvita. So again, there's a few very specific curcumin strains that have been well researched. So if it's something you're interested in, you might want to talk with your healthcare provider about a specific brand. But again, I think this is really one of the top things that I use in my practice to help control inflammation.
So a couple questions. So someone's just listening to this, they want to try it. And again, I know it's very individual and you really need to talk to your healthcare practitioner. But are there any guidelines like where you'd start, how much, how many times a day, in the morning, at night? So some specifics here. Yeah.
So a lot of the curcumin extracts are typically 500 milligrams per capsule. Again, depending on your size and your sensitivity, starting with 500 to 1,000 milligrams a day is a good place to start. For people like I'm 6'2" and weigh 225 pounds, I'll take 6 capsules a day, 3,000 milligrams. So the range is probably somewhere between 1,000 and 3,000 milligrams for most adults. Again, if you know you're a sensitive person, have a sensitive stomach, you might want to start small and then just increase it as you feel like you tolerate. Now, of course, if you use a lower dose and you feel like the inflammation is going down, you're feeling better, great, just stay there. You don't necessarily have to use a higher dose. But I have some patients, that are having like sort of an acute inflammatory crisis. They need the higher dose, at least for a short period of time, to get things under control. And once you feel like that's well controlled, you can bring the dose back down again to a lower level just to maintain that inflammation.
And some people have chronic inflammation. So do you have patients who just stay on this? They stay on this for life?
Yeah, obviously, depending on what's driving the inflammation, hopefully we're getting to the root of what that is. Is it inflammation secondary to infection? Is it really anatomical, where maybe you've got bone on bone in your knee and maybe you need, some other therapy to help that, or maybe you need surgery? So for me, anti-inflammatories aren't necessarily something you want to stay on your whole life. There's something that's causing that inflammation, but it buys us time to hopefully figure out the root cause of what's driving that inflammation. And once we correct that underlying issue, hopefully you don't need the anti-inflammatories.
Okay. Okay. Anything else? And what about just the turmeric on the food? There's certainly no harm in it, but
Yeah, like I said, turmeric on food, it'll have some of that curcumin. And, again, I think about Indian culture where it's heavily used in a lot of the food, the curries and things like that. I think most Americans don't eat a lot of turmeric. It's not a spice that's common in the average American palate. But again, it's something that's very easy to start adding turmeric to your food. And again, you just never know. I mean, sometimes a little goes a long way. If it's something you're using on a regular basis, you may find over time that it does help, manage inflammation. So I think it's worth trying if you like the taste of turmeric. If you don't really enjoy the flavor of it, then you can certainly just take curcumin capsules. It doesn't have any flavor, and that will still help.
This time of year at the farmer's market now, they actually have the roots. They have the actual plant that you can make tea with. I always buy it, and it's great. So there's a short period of time. I'm not sure where you are in California, but in the East Coast, there's a period of time where you can actually purchase it at the farmer's market, and it's really good.
Yeah,
Okay.
well, we see that with other things like ginger. Ginger is actually another great herb for, reducing inflammation and pain. Ginger is also a herb that's what we call diaphoretic, where if you get enough of it, it opens up your blood vessels and can actually get you to start to sweat a little bit. But, there's a lot of research on ginger as a way to help modulate pain. And again, you can buy fresh ginger root, just, shave it in little slices. And if you like the flavor of ginger, again, you can actually eat it directly. You can steep it in a tea. You can make a tea out of it. You can grate it and put it in your food. So ginger is another great root that you can do a lot of things with. And again, ginger is such a potent herb. You don't really need a lot of it. The other great thing about ginger is that if you're dealing with nausea, ginger is one of our best anti-nausea medicines out there. So we use it, nausea when they're pregnant, nausea if you've been dealing with like food poisoning or something like that. So a lot of great benefits to ginger. And again, every, grocery store in the world sells ginger root. Again, you can buy ginger tea that's already pre-made, but fresh ginger, I think, is always best.
I love ginger. I put it in my smoothies. I mean, I like the fresh ginger and just toss it in, and it gives such a good flavor. And, it has so many benefits. But you're right. When there are numerous people I've known who've had chemotherapy, and this was key. It was such an important piece and really helped them get through, as well as women who are pregnant too. So such
Yeah.
a good herb, but so nice that it helps reduce inflammation, joint pain, even as we age, it's just a nice tool to have in our toolbox, and it's easily available. So you just recommend with ginger, do you recommend just using the herb, or do you actually recommend doing it in capsules or anything like that?
Yeah, I mean, they do make ginger capsules if you wanted a higher potency of ginger. And again, sometimes, ginger, fresh whole ginger can be a little caustic. It can be irritating if you get really high doses of the whole fresh root. Depends on the individual. So for people who either don't love the flavor of ginger or they find it's a little irritating to your stomach, you can try and just take the ginger capsules. And again, that will deliver a higher amount of ginger than you might get from just eating the whole root.
One other question on ginger. I know it increases motility, and certain people with SIBO or other things have reduced motility, meaning it just takes a long time for things to, well, it the same for people listening, for things to travel through the system. And I know ginger is one of the treatments even the gastroenterologists use. They recommend ginger. So have you found that also?
Yeah, ginger can help with motility for people that are struggling with any kind of underactive bowel function, low motility, where you get tendency towards constipation, gas, bloating, SIBO. Ginger does a nice job of helping kind of keep things moving through the gastrointestinal tract. So it's a big gastrointestinal remedy for a lot of different things. Again, we use it for nausea, we use it for constipation, we use it for other GI related issues. But again, I like its ability to control inflammation and pain. So the fact that it's such an easily accessible herb that anybody can find, as I'm talking about herbs, I didn't say it earlier, but I always recommend when possible to get organic. Just make sure there's no additional pesticides and herbicides that have been used on the plant. We don't want to accidentally contaminate you with these chemicals if we don't have to.
It's just such a win-win and easy to put into your life. But you brought up such a good point because a lot of people, and I see this all the time, people just don't realize what can be in these very healthy foods. So do you want to just delve into that a little bit more? Because, people think, oh, it's more expensive, or I'm not going to bother with it. This is what I see. People really don't, I mean, some people do, but I just see that it's not always appreciated what could be in these extremely healthy foods.
Well, plants as a whole, I mean, when we talk about herbs and other plants, think of them as food. The way they're utilized in the body is really no different than eating any other food. You take the herb in, it's digested, it gets broken down, it's absorbed in usually the first part of the small intestine. So what that means is that, these herbs can get in your body relatively quickly. Much like other nutrients, that you get from food, your protein, your carbohydrate, your fat. So the ability of these plants that contain often, dozens of different constituents, all of that kind of gets distributed throughout the body wherever it's needed. So in some cases, again, it's delivering a high nutrient content, whether it's like green tea. Green tea is very rich in polyphenols, which have anti-inflammatory effects, anti-cancer effects, anti-cardiovascular disease effects, all these different things. So those polyphenols are really healthy and beneficial to the body. Again, in other cases, it's, these constituents that, whether it's reduce inflammation, promote better circulation, some plant constituents help boost your immune system. If you look at any one plant, and it's kind of funny because, again, if you look at most of the drugs on the market, the overwhelming majority of them were derived from plants. But to make it a drug that can be patentable, they have to take something out of the plant, tweak it in the lab a little bit to make it something unique, because you can't patent Mother Nature. And then that's what they make a lot of drugs, especially like a lot of the chemotherapy drugs that they use for cancer treatment. So, we have a very long history of using plants as medicine, or at least a lot of the medicines being derived from plants. And the reason is, again, is that they have all these different components that do various different things in our body. So, of course, the drug industry kind of tries to co-opt that and take the one thing that, they think is the active ingredient that does all the magic work. In reality, it's probably the combination of these compounds in the plant that work very synergistically together. When I was studying herbal medicine in naturopathic medical school, they'll talk about, well, which part of the plant is best? Is it the aerial part, which is like the flowers or the leaves? Is it the stem? Is it the root? because sometimes different parts of the plant concentrate in a different area of that plant. In some cases, you grind up the whole plant from root to leaf. Other cases, it's the berry. Other cases, it's the certain part of it. So, it's helpful to understand the plant, what part of the plant has those, ingredients that are really helpful. But again, I think, Mother Nature has a wisdom to it that these plants are designed to work in a way that, when we ingest them, hopefully we get all the benefits. So more often than not, when we're using herbs, often we're using, the whole plant. In some cases, again, we're using that part of the plant that we know has the health benefits. But again, I don't think we fully appreciated everything Mother Nature's given us, and that we've got this toolbox that we can often grow in our backyard that gives us all these great health benefits.
Yeah, no, it's just, as I said, it's such a win-win. Okay, so we have the two that you mentioned. Are there any other favorites for inflammation?
Yeah.
Yeah.
One of a couple of my other favorites. One's Boswellia. Boswellia comes mostly from India. It's frankincense, and frankincense is a great anti-inflammatory herbs. It comes from the gummy resin. It's this thick, sappy stuff that comes from the Boswellia tree. But again, lots and lots of research as an anti-inflammatory. So often we'll see Boswellia combined with curcumin. That's kind of a nice 1-2 punch of modulating inflammation. So I like frankincense a lot. And there's another herb called cat's claw. It goes by una de gato. That's the Spanish name. It's used all over the world for various types of anti-inflammatory conditions. They use it for arthritis. They use it for headaches. They use it for any type of painful condition. The other nice thing about cat's claw is it's a great antimicrobial. We've got lots of research in terms of treating something like Lyme disease. I've used it to treat strep throat and other types of infections. And again, it's one of these great broad herbs that covers a lot of different bases. But I remember back in the day, if I ever twisted my ankle, instead of taking something like Aleve or ibuprofen, I would just start taking cat's claw. And usually within a day or two, that would really help control inflammation. I also should mention cinnamon, another common herb that we find in our cabinet. Cinnamon's a great anti-inflammatory. It's got antioxidant properties. I love the taste of cinnamon. I add it to a lot of different things. Kids love cinnamon. So cinnamon's great for kids that are having, inflammatory issues, health issues. But again, it's a common spice that most of us have in our cupboard. If it's already sitting there, let's take advantage and use it.
Hey, Margie here. As a physical therapist, I know firsthand how important exercise is for our bones, overall health, and happiness. And unfortunately, there's a lot of confusion on what exercises are safe and effective for people with osteoporosis. That's why I created this handout that contains a 30-minute video where I explain the concepts so you understand the do's and don'ts when it comes to exercise. And this is important because this way you can go into any class and know what you should be doing and what you should avoid. Because too many people are doing exercises that actually increase their risk of spinal fractures. I also included videos of me demonstrating effective balance, posture, and weight-bearing exercises you can put into your day right away. So all you need to do to access this handout, it's free, is go to tinyurl.com/osteoporosis exercises. So it's tinyurl.com, again, /osteoporosis exercises, or you can click the link in the show notes. Now back to the show. I just want to go back to something. So someone who has acute inflammation, because you mentioned when you were injured, you took the cat's claw.
Yeah.
At what point do you want to, because sometimes the inflammation's good, it's helping the healing. So sometimes we don't want to take Advil, we don't want to take because that can really impede the healing, but it's a little different when you use nature's medicine. You want to share the difference with that?
Well, the difference is dosing. So, when you're using natural things for acute inflammation, like again, I rolled my ankle, it's swollen, it's purple, it hurts a lot. We'll do the external things like we'll put ice on it. We might do compression. But again, I might start taking curcumin, but instead of taking a couple of capsules a day, I might take 2 capsules every 3 hours. I'm going to dose it fairly high because we really want to try and get that inflammation under control so that the body will start its natural process of healing. And again, usually you'll do high doses for 2 or 3 days following the acute injury, the acute inflammation, and that as the inflammation starts to quiet down, you see the swelling go down, then you can start reducing the dose, and then you might be at a lower dose until the injury heals. So the process might be a little bit longer. The process might be a little bit where when you take something like ibuprofen, you just kind of take the same dose every day until it goes away. With, when we're using herbs to control inflammation, at least for acute inflammation, we're usually using higher doses for the first handful of days, and then we start reducing the dose as the inflammation gets more well controlled.
Okay, thank you. So any others? These are all so good.
The other one that I think very well known is white willow bark. So white willow bark is where they developed aspirin. Aspirin originally came from, there's a compound in it called salicin, and salicylic acid is what aspirin is. So again, this is a very old, well-researched, known herb to control inflammation. Again, it's one of these things where you kind of have to start off with a fairly high dose for acute inflammation and lower it as time goes on. But it's much safer than taking actual aspirin, where again, it doesn't break down the stomach lining. We don't see the kind of gastrointestinal effects that we see with the other types of anti-inflammatory drugs.
Okay, so let's go back to, is there any other properties you want to discuss that could help all of us?
Well, with herbs, in addition to, again, the inflammation, again, herbs do a lot of other things. So that's really going to depend on the individual and what your specific health issues are. But again, a lot of these herbs are good for cardiovascular health. They're good for your metabolic health. We talk so much these days about metabolic fitness, blood sugar control, insulin control. We've got great herbs out there for people who are pre-diabetic or even frankly diabetic to get better blood sugar control, overcome insulin resistance. We know that people who are diabetic or pre-diabetic are also at higher risk of osteoporosis. So if we can get you metabolically fit, that's going to reduce your risk of having, bone loss. So, things like there's an herb called Gymnema. Gymnema sylvestre is a great herb for dealing with blood sugar control. I mentioned cinnamon already. Cinnamon's another one that works really great for blood sugar control. So, we've got so many, for pretty much every condition out there, there are probably some herbs that help that condition. It's just a function of, knowing what those plants are and the best way to use it. So, I always recommend to get in the hands of a naturopathic doctor or someone who's trained in herbal medicine if this is something you really want to explore. Again, there's so much that's in your kitchen cabinet, but there's so many other ways that you can use herbs that might be a little bit outside of your knowledge base, and it's good to consult a professional who really understands the best way to deliver the herbs. Because sometimes herbs are better delivered through capsule, sometimes they're better through tea, sometimes they're better through tincture. And so if you know what plant you're trying to use, you know which way is the best way to get it in your system.
It's so interesting with the blood sugar, because that's another thing people don't appreciate. And a lot of times the doctors will like, oh, you're fine until you have diabetes. But they found that people with an A1C of 5.7, which is, pre-diabetes, have a 24% increased risk of fractures. That is huge. So there's such a correlation, and I don't think we appreciate. So how wonderful that we can use herbs to improve everything with our metabolic health, including our blood sugar. Before I have some questions, because I'm so excited about your class where you will really go into this in detail, but what are the dangers? You talked about the toxins. Are there any other dangers that people have to know about in terms of the herbs?
Well, the good news with most herbs are considered, the FDA calls them GRAS, which means generally regarded as safe. So, when you look at the studies on the overwhelming majority of herbs that you can buy out there in the world, they're pretty safe when taken as recommended. There are a handful of plants out there that do have toxic components, and medicinally, sometimes we do use those, but you have to really know the plant well and understand how to use it. But by and large, you're not likely to harm yourself in any way. I think where the The concern comes up is if you are on a lot of medication, there are some medications that do conflict with certain herbs. And so, if you're going to start on any kind of herbal regimen, like if you are on blood thinners, if you're on Coumadin, you might want to be careful if you take too much garlic. You might want to be careful if you take, I'm trying to think of other plants that might, but garlic's one of them. Anything that might be perceived as a blood thinner, would the herb have a synergistic effect with the medication, make the medication more effective, or make the effective to the point where you start having side effects? Would it cause you to bleed too much? So it's a good idea just to do a double check. And there's a lot of databases out there now. If you're on certain, heart medication, blood sugar medication, you can put in the medication, and then you can put a list of the herbs, and it'll run a check. And at least anything that's known, we can just do a quick check. So I use a program called Hippocrates that's on my iPhone. I can put in the medication, I can put in the herb, and just do a quick check and just make sure that there's no contraindication between the herb and the medication. In most cases, if you're just using herbs in your food, that's not likely to happen. But again, if you're going to be using higher doses of something like curcumin, it might be a good idea just to double check with your doctor. Or again, there's a lot of online databases where you can run the check yourself and just make sure there's no problem.
Yeah, because it's interesting. A lot of the physicians aren't really trained, unlike you, are not trained in herbal medicine. So they have to go to the data. What I found is they don't really know that they have to go to the database or go to their pharmacist or go to somebody to look it up, because a lot of times they're like, it's just not something they deal with.
The general story is if they don't know, they tell you not to do it. And that's not helpful. Just because they don't know doesn't mean that you can't do it. Again, it just takes a little bit of effort to do a check. So if you talk to your doctor and they don't know anything about it and they said, "Oh, just don't take it, I don't know," that's not good enough. Find out if it actually is an issue, because again, if it's not an issue, it's not a problem, it's really beneficial to be able to start incorporating these into your life.
Well, I love that you put together a free masterclass for people. So you want to just share why you did that, number one, and what are you discussing? Like, what will people get from this?
Well, a lot of this came out of my own experience. I was a Lyme disease patient, and I was on, conventional antibiotic therapy for a long time that didn't help me. And it was really herbs that got me over the hump and helped, cure my Lyme disease. And, that was just my own personal story of, how herbs could be so powerful. Because again, I had the inflammation, I had the joint pain, I had headaches and all these kind of symptoms. And then, of course, over now the years, this was 20 plus years ago, I've just seen how powerful herbs are in medicine. And again, I think, it's become kind of a lost art of using these tools that nature gives us to help heal people. So I'm actually partnering with Dr. Bill Rawls. He's a medical doctor in North Carolina. And like myself, he overcame Lyme disease with herbs. He and I have a very similar story in our Lyme journey, where we both failed antibiotics, and herbs were really the things that got us well. And he's also, as a medical doctor, I really appreciate, he's very passionate about, teaching others about how to use herbal medicine, not just for Lyme disease and tick-borne illness, but how we can apply it to all these other health conditions that are really just plaguing our nation, between, heart disease, cancer, diabetes and blood sugar issues, PCOS. We've just got all these health issues that seem to get worse and worse every year. So we are doing a 4-day live event that'll be running November 18th through the 21st. And we've got guest experts coming on the first 3 nights. So the first night, Dr. Tom Moorcroft, he's an osteopathic doctor in Utah, is going to be joining us. And we're going to talk about how to use herbs in dealing with infection. We'll talk about Lyme disease, but we'll also talk about other types of infections, like sinus infections, bronchitis, urinary tract infections, and how you can treat all these using plant medicine. On the second night, we have Dr. Nancy O'Hara, who is a pediatrician, and we're going to talk about inflammation. So we'll go kind of a deeper dive on what you and I talked about today, about how we can use herbs to help control inflammation. And the fact that she's a pediatrician, we'll also talk about how you can use herbs with children, because I know a lot of parents are very concerned about using, herbs with their kids. On the third night, Dr. Jaquel Patterson, she's a naturopathic doctor. She's actually the doctor that took over my practice in Connecticut when I moved. She's brilliant, and we're going to talk about using herbs for detoxification. such an important part of getting well. And so many people dealing with chronic illness generally don't detoxify very well. So we'll do a deep dive on, again, how you can use herbal medicine to help improve your kidney function, your liver function, get you to sweat, open up all these detox pathways. And then on the fourth night, Dr. Rawls and I are just going to open up a Q&A for everybody who joins the webinar and help answer all of your specific questions on, again, how can you use different herbs to deal with the various issues that you're dealing with. So I think this will probably go out before we're going to do a webinar on November 13th.
Yes, this is going to be out so people can tell us about the webinar, the actual.
So the webinar is going to be on Wednesday, November 13th. This is absolutely free. We're inviting everybody to come join the webinar. Dr. Rawls and I'll be on to help, again, answer your questions about herbs. We'll talk a little bit about, how you can use different herbs for, we're going to try and cover kind of a smattering of different conditions just to help appreciate what these plants do. But we invite people to come with their questions so you can understand, what herbs can do for you. But it's a free event. It's going to be, I believe, we just set the time. It's going to be 4:30 Pacific time, 7:30 Eastern time on Wednesday, November 13th. So we just, we'd love for people to show up and help answer their questions about how to use herbs in your day-to-day life.
I love this because knowledge, I've always said this a million times on the podcast, knowledge is power. And, here they are sitting there in the garden, sitting there, things that can really help us, but we just are confused and don't know. So I love that you're going to really help people figure it out so they can use it to benefit their lives. Now, if people are listening, because a lot of people listen to the podcast later on, you did tell me that this will be available as a replay. Is that correct?
Yeah, so the webinar on the 13th will be recorded. So if you miss it on the 13th, if you sign up, you'll get a copy of the replay. We'll send that email out probably the next day. And then the live event will be the 18th through the 21st. And again, if you happen to listen after that, we're going to put this on the website. It'll be available for anybody who's interested in signing up after the fact. It won't be live, but at least you'll get a chance to listen to all that great content. And again, I think we're going to have 4 really great nights of valuable information. You're not going to want to miss that.
Yeah, I'm going to come. This is fantastic. I know I use herbs all the time, but I am certainly not an expert. And I always look to people like you, Darin, for advice, how I can, really maximize the effectiveness of the herb. So this sounds just so fabulous. And I will make sure to have the links, again, down the road, if this is after the fact. Right now, it's not. Right now, you can do everything. And it's great that they can sign up. Even if they can't come on the 13th, they can sign up and get the replay and get all this great information. Oh, my goodness. Well, this is just wonderful. And it really will help your bones. That's the beautiful thing, that when you do things to reduce inflammation, your bones improve. And we've seen this when we look at the markers. I love the fact that more and more people now are getting the bone turnover markers, measuring the CTX and measuring the breakdown of bone. And we're seeing that value is reduces when people implement measures to reduce inflammation. So I think that's so exciting. And then also as time goes on, bone density, things improve. So everything just goes in the upward trend. So this is just such a win-win in so many ways. But is there anything else you want to share before we end? I really appreciate you, talking about these things and things that we can right away start adding to our life and not, forgetting about that little bit of ginger, throw it in your tea or throw it in your smoothie.
Well, I think you kind of summarized it well. As we get you healthier, your ability to maintain good bone health, it's easier. When you're doing all the other right things, we start to see your bone growth go up more significantly. When we start improving your nutrition, when we start reducing inflammation, when we start making you more metabolically fit, all of these things lead to better bone health. So that's really our goal for everybody, is that, you got one life, right? We want to give you the best life possible. And we want you feeling great. We want people to be able to live to their 70s, 80s, 90s, feeling fantastic. And I think that's possible. And herbs are a great way to get there.
I love that. One more thing I just want to add is that a lot of people are on medication that actually have negative effects on their bones. So another thing we really didn't touch on, but I'm sure you'll touch on that, is that there are herbs that can help you get off your medication. So they're herbs that you can, down the road substitute. So I think that plays a huge role in, in helping your bone health and overall health. And even your happiness, I'm big into that. Your happiness and stress, you can use herbs for all of that too.
That's
So yeah, very excited about your class. Thank you so much for sharing this with us. And I'm looking forward to it.
great. Thank you so much, Margie.
I hope you enjoyed my interview with Dr. Darin as much as I did, and now have some new ways that you can use herbs in your life to reduce inflammation, improve blood sugar, and so much more. And the good news is that when you do this, it can significantly improve your bone health. So it's just such a win-win situation. All the links that Dr. Darin talked about will be in the show notes to both his free webinar, which is on the 13th of November, as well as his class that's starting November 18th. But don't worry, if you miss it, there'll be replays of all of this. So thank you so much for tuning in, and I look forward to seeing you on the next episode.